Greetings one and all, my name's Manu and I'm a rural GP. Just a quick video with the upcoming Easter about commonly faced issues in rural medicine, particularly at public holiday times and extended holidays as we are coming up into. For many years I've done rural medicine, primary care, but also secondary care, covering hospitals and looking after hospitals, be it as an officer or as a superintendent. The primary problem faced in rural medicine, particularly in Australia, during the sort of holiday periods, especially longer holiday periods, is the lack of cover in primary care. Understandably so, as it is, we are short in permanent and long-staying rural doctors, but obviously they need a holiday time too. They've got families, they've got things to take care of, they go away as often, and especially it being school holidays, it makes things slightly worse. That's nobody's fault, that's life. The reality is everybody tends to chip in. Public in rural towns tend to be very supportive, very understanding. They are aware that there is often a shortage in cover, and they often get their issues sorted out prior to the holidays, and often a lot of them are away themselves. The second thing that we often face is the difficulty in filling rosters at local hospitals. Obviously, emergencies, trauma, and a lot of critical issues go to hospitals. GPs often cover the hospitals themselves as in addition to primary care. But we often have difficulties filling up rosters. The way around this that we worked out over the years is to have locums. There was a period of quite a number of years when this became almost a lifestyle to have locums and only locums. But of course, the good thing moving forward is there's a lot more permanency now in Australian rural medicine, covering hospitals, and that's a good thing because they develop relationships with the town, they learn the towns, they learn the services, they learn the shortfalls and also the strengths, and they can anticipate what to do with a particular presentation as opposed to a locum arriving and having to learn the town rapidly. On that note, hats off to the locums who come in short notice and learn rapidly and hit the ground running. Rural medicine can be very daunting, especially when you're it for hundreds of kilometers at times. So the other set of champions are the support staff, the nurses, the wardies, the groundskeepers, even the cooks. Everybody helps out. I've been in time and time again resuscitations where we've used our wardsman, our chef, and our backup cleaner to help us with resuscitation, and we've championed our way through it. So a thank you to all rural staff who work during and not during holiday period and periods in rural Australia. One final problem that we often face is the shortage of retrieval services. We live in a country where we underestimate and don't give enough credit to arguably one of the greatest retrieval services the world has ever seen. The network we have formed in a country of just 20 million people, with the size of a continent to cover, using volunteers, using staff who work in their twilight years, staff who commit themselves from the very beginning, funding from private and government organizations and communities to cover helicopters, ambulance services, planes, the flying doctors. And we really sometimes take it for granted. It is an extraordinary service which costs us a lot of money to run as well. And we do have a shortage of that during holiday periods. We often work around this by anticipating and knowing how to prioritize. The clinical coordinators are very good at that, and we often have to have patience, we often have to have faith, and we often have to bunch together as a team. Sometimes we have to hold on to patients who we would retrieve very quickly and who are often sicker than we can handle by getting telehealth support from specialist staff in hospitals to help us keep them safe. Because as always, Murphy's Law applies during holiday periods. When the proverbial is going to hit the fan, it's going to hit the fan during holidays. And everybody in rural medicine knows this. And so we're often prepared for it, but often we're not. And we adapt on the fly. A shout out to everyone in rural medicine, and a shout out to everyone in rural community care. And I wish you all a very happy holiday period. Thank you.